Hello, everyone. My name is David Odeej. Let's continue our previous topic of cardiovascular diseases. Now we will discuss Chapter 38, Heart Failure of our book, Lewis's Medical Surgical Nursing, Assessment and Management of Clinical Problems. Heart failure, or HF, occurs when the heart is unable to pump enough blood to meet the body's needs. This happens because the heart muscle becomes damaged or weakened, leading to poor circulation, fluid buildup, and fatigue. The primary risk factors for heart failure are hypertension and coronary artery disease. In addition, there are several precipitating causes that can worsen or trigger heart failure. These include anemia, bacterial endocarditis, dysrhythmias, fluid overload, hypothyroidism, infection, nutritional deficiencies, and obstructive sleep apnea. Recognizing and managing these factors early is key to preventing progression of the disease, heart failure, and maintain follow-up appointments. Now let's look at the difference between left-sided and right-sided heart failure. In left-sided failure, the left ventricle can't pump blood effectively to the body. This causes blood to back up into the lungs, leading to pulmonary congestion, shortness of breath, cough, and crackles. Patients may also experience fatigue and cyanosis due to poor oxygenation. In right-sided failure, the right ventricle fails to pump blood into the lungs effectively, causing blood to back up in the systemic circulation. This results in peripheral edema, jugular vein distension, hepatomegaly, ascites, and weight gain. Left-sided heart failure occurs when the left ventricle can't pump blood effectively during systole or fill properly during diastole. As a result, blood backs up into the lungs, leading to pulmonary congestion. Common signs and symptoms include crackles, a dry hacking cough, shallow respirations, and chest tightness due to fluid buildup. You may also notice S3 and S4 heart sounds, low oxygen and elevated carbon dioxide levels, and patients may appear restless or confused because of poor oxygen delivery to the brain. Right-sided heart failure occurs when the right side of the heart can't pump blood effectively to the lungs, causing blood to back up into the systemic circulation. As a result, fluid begins to accumulate throughout the body. Common signs and symptoms include jugular vein distension, hepatomegaly, ascites, and peripheral edema, which can progress to anasarca or generalized body swelling. Patients may also experience weight gain, fatigue, nausea, GI bloating, anorexia, and right upper quadrant pain from liver congestion. Diagnosis begins with a thorough history and physical examination to identify symptoms and possible underlying causes. Next, several laboratory tests are done. These include serum chemistries, cardiac biomarkers, BNP or NT-proBNP levels, liver and thyroid function tests, CBC, lipid profile, kidney function tests, and urinalysis to assess organ function and fluid status. Imaging and diagnostic studies are also essential. A chest x-ray helps detect heart enlargement or fluid in the lungs, while a 12-lead ECG can identify rhythm abnormalities or ischemic changes. A 2D echocardiogram is one of the most important tools. It evaluates heart structure, ejection fraction, and valve function. In some cases, nuclear imaging studies or cardiac catheterization may be used to assess blood flow and confirm the cause. The main goal of treatment is to reduce symptoms, improve heart function, and prevent disease progression. Nitrates help by dilating blood vessels, which decreases workload on the heart and relieves chest discomfort. Beta blockers slow the heart rate and reduce blood pressure, helping the heart pump more efficiently. Loop diuretics, such as furosemide, remove excess fluid, reducing pulmonary congestion and swelling. ACE inhibitors are cornerstone drugs. They relax blood vessels, lower blood pressure, and help prevent further heart remodeling. Now let's talk about nursing management in heart failure. Our main priorities are monitoring, medication adherence, lifestyle management, and patient education. We begin by monitoring vital signs, weight, and fluid balance, while keeping a close watch for symptoms of fluid overload such as swelling or shortness of breath. Medications may include ACE inhibitors or ARBs, beta blockers, diuretics, aldosterone antagonists, and digoxin, depending on the patient's condition. We also reinforce lifestyle modifications like a low sodium diet, fluid restriction, smoking cessation, and daily weight monitoring. Gentle exercise can help improve tolerance and circulation. Oxygen therapy is provided for patients with low oxygen levels or severe symptoms. Equally important is patient education, helping them understand their medications, recognize early signs of worsening heart failure, and maintain follow-up appointments. Now we will discuss Chapter 23, Pediatric Cardiovascular Disorders, especially heart failure. Pediatric heart failure occurs when the heart can't pump enough blood to meet the body's needs. In children, it's often due to structural defects like septal abnormalities or impaired heart function from cardiomyopathy or dysrhythmias. It may also result from excess workload, such as in sepsis or severe anemia. In right-sided failure, the right ventricle can't pump blood into the pulmonary artery. This causes increased venous pressure, leading to hepatosplenomegaly and peripheral edema. In left-sided failure, the left ventricle can't pump blood into the systemic circulation, causing blood to back up into the lungs, leading to pulmonary congestion and edema. Heart failure rarely occurs on just one side. When one side fails, the other is soon affected. If not corrected, this results in myocardial damage, decreased cardiac output, fluid overload, and congestion in both systemic and pulmonary systems. Children can present with symptoms in three main categories: impaired myocardial function, pulmonary congestion, and systemic venous congestion. With impaired myocardial function, you'll often see tachycardia, fatigue, weakness, restlessness, pale and cool extremities, and decreased blood pressure and urinary output. Pulmonary congestion leads to tachypnea, dyspnea, orthopnea, cough, wheezing, and cyanosis due to fluid buildup in the lungs. And with systemic venous congestion, you may observe weight gain, hepatomegaly, peripheral edema, ascites, and neck vein distension. Recognizing these signs early is critical to prevent worsening heart failure and guide prompt management. Diagnosis is based on a combination of clinical symptoms and diagnostic tests. Clinically, affected children often present with tachypnea, tachycardia even at rest, dyspnea, retractions, feeding or activity intolerance, weight gain due to fluid retention, and hepatomegaly. A chest x-ray may show cardiomegaly and increased pulmonary blood flow. An ECG often reveals ventricular hypertrophy, abnormal rhythms, or decreased voltages, while an echocardiogram helps identify the underlying cause, such as a congenital defect or poor ventricular function. The main aim is to improve cardiac function by increasing contractility and reducing afterload. We also work to remove excess fluid and sodium to lower preload and prevent volume overload. Another key goal is to decrease cardiac demands, improve oxygenation, and reduce oxygen consumption. In infants, heart failure is often caused by congenital heart defects, so we stabilize them medically first and then refer for early surgical repair. In older children, the cause may be postoperative ventricular dysfunction, cardiomyopathy, or arrhythmias. In all cases, it's essential to treat the underlying cause alongside managing heart failure symptoms. The nurse plays a vital role in continuous monitoring, keeping track of vital signs, respiratory effort, oxygen saturation, weight, and fluid balance. We also administer prescribed therapies, including medications like digoxin and diuretics, oxygen therapy, and fluid restrictions. To promote rest, we cluster nursing care, limit activity, and maintain a calm, quiet environment. Nutritional support is essential. Offer small, frequent, high-calorie feeds to prevent fatigue during feeding. Education and emotional support are equally important. We teach families how to give medications, recognize signs of worsening heart failure, and stress the need for regular follow-up. Finally, we provide reassurance and emotional support to both the child and family to reduce anxiety and promote confidence in home care. Thank you all for listening. I hope this session helped you better understand today's topic. Your attention and participation are greatly appreciated. Keep learning and caring with compassion.